The omega-3 fats are going to be important for many medical conditions. You want to reduce inflammation, reduce autoimmune disease. They're helpful for conditions like Alzheimer's, arthritis, again, the autoimmune conditions, migraines, depression, heart disease. All right, I know this is a confusing slide here. I'm going to walk you through it though, all right? So this is a slide from my friend Alex Vasquez, who's written a book called Integrative Orthopedics and Integrative Rheumatology. These two pinkish squares up here are omega-6 fats, linoleic acid and arachidonic acid. What happens is when you eat vegetable oils or meat or eggs that contain these substances, they go to your nucleus and they stimulate NF-kappa B. That NF-kappa B then goes to your DNA, which is up there at the top, and it produces a boatload of inflammatory chemical compounds that promote pain, promote inflammation, promote heart disease, promote dementia, and cancer. All right, now if you have the omega-3s, alpha-linolenic acid that's in flax, EPA and DHA that come in fish, those deep cold water fish like salmon, cod, mackerel, halibut, sardines, they go to your nucleus and inhibit NF-kappa B. They also stimulate a molecule called PPAR gamma. PPAR gamma has to do with how sensitive the receptors in your cell membranes are to insulin. So you want that to happen. That's one of the few things that is, the PPAR gamma is helpful with reducing dementia, Alzheimer's. And again, it's very helpful with making your cells more sensitive to the insulin that's around. And you want to have low levels of insulin to reduce this proliferation of cancer. So you have NF-kappa B inhibition, and so you get reduction in nitric oxide synthase, which promotes hypertension. You get reduction in IL-6, one of those inflammatory cytokines that we talked about that promotes inflammation, promotes growth of cancer. You get reduction of TNF-alpha, which also is very important to cancer. So you want to have those omega-3 fatty acids producing molecules that inhibit inflammation, inhibit cancer. Now you'll also see over here something called GLA, DGLA. That is one omega-6 fatty acid that inhibits inflammation, but the rest promote it. We need both of them. We can't make either omega-6 or omega-3. So you need to have inflammation if you step on a nail, but you also want it to turn off, right? So that's why we need to get more omega-3s and get back to that 1-to-1 ratio that Weston Price was seeing when he went around the world. Again, a busy slide. But what you'll see is you have the omega-6 pathway over there on your left and the omega-3 on your right. And they go through several steps before they get to the real inflammatory and anti-inflammatory compounds down here at the bottom. And what you'll see is that that second line there is the same molecule, delta-6 desaturase. If you overwhelm your system with too many omega-6s for every one omega-3 that you get, you're never going to get down here to these anti-inflammatory eicosanoids. So we've got to limit, most people need to limit the omega-6s that they're getting as well as take more of the omega-3s and get rid of the trans fats altogether. So one way you can bypass several of these steps is to go directly to fish oil. And you look on your bottle. Many of the bottles are misleading. They'll start out, you'll say on the front, 1,000 milligrams of fish oil. Turn your bottle around and look at the back for how much EPA and DHA is in there. Most people want to aim for somewhere around 1 to 2 grams of EPA and DHA per day. So some of the brands, you'll get 1,000 milligrams fish oil on the front, and you turn it around, it's 100 of EPA and DHA. And you may end up having to need 10, 12, 18 pills to get what you're really looking for in terms of the EPA and the DHA. In terms of avocados, flax, walnuts, they start up at the top at that alpha-linolenic acid, and we know that by the time you get down to the bottom, the real good stuff, there's only a 5% conversion rate. A little bit more if you're pregnant, but none of us are in this room. Okay?
How do you know?
Huh? How do I know? Okay, you're not telling me something there, huh? Okay, so I'm going to talk a little bit about hyperglycemia. Remember I earlier talked about we really want to avoid those high peaks in glucose because that leads to a outpouring of insulin. And insulin, when you mix it in the lab, promotes growth, promotes proliferation. So we want to make sure we're doing the best we can dietarily to keep our blood sugars low and steady. So how do we get to hyperglycemia? There are a couple of different things that can lead to hyperglycemia. One, you can have too rapid a digestion of the carbohydrates in your intestine. You may not have enough muscle mass for that glucose to go somewhere. We know as you age, you tend to have less muscle. It's one of the reasons why weightlifting or resistance work is so important, so you can maintain your muscle mass and have a place for that glucose to go to. If your pancreas gets burned out by having to work so hard day in, day out and deal with regular bursts of high glucose levels, your pancreas can eventually have impaired insulin secretion. And then in the liver, there's a process called gluconeogenesis that creates new glucose, even though you may not need it anymore. This process can be turned off with a medication called metformin. It can also, well, you can limit it by staying away from high sugary foods, particularly high fructose corn syrup. We think that fructose and alcohol get metabolized in the liver in a very similar way, and both contribute to gluconeogenesis. So here are some of the kind of integrative ways we can help lower our hyperglycemia. One, eat a lot of fiber. And remember I said we're not getting anywhere near the amount of fiber that we used to. So fiber will slow down the digestion and absorption of the carbohydrates that you're eating. You can also improve how the insulin receptor at your cell membrane level works by things like vitamin D and fish oil. Because remember that fish oil works on that PPAR gamma to make that insulin receptor more receptive to the insulin that's around. A lot of what we're seeing nowadays is insulin resistance, type 2 diabetes, where the pancreas is working harder and harder and harder, producing more and more insulin. It's actually high insulin levels. It's not that there's not enough insulin, but it's that the pancreas is having to knock harder and harder and harder to get the message across, so you have more insulin levels. You can help lower those by making the receptor hear better. So omega-3 fish oil, magnesium, alpha lipoic acid is an antioxidant that will help sensitize to insulin. Chromium, vanadium. Exercise will also sensitize your insulin receptors, make them work better, and it increases by far uptake of the glucose into your muscles. Chromium, magnesium again, and then vitamin D is another big one. Vitamin D can reduce your insulin levels by as much as 60%. All right, so other things that you can do that can help with insulin sensitivity, many of the spices. Green tea is huge. Cinnamon will help reduce gastric emptying, slow down that insulin and glucose rise. So have a teaspoon of cinnamon every day. What else? So green tea is another compound that is going to have many benefits above and beyond lowering your insulin needs. It's got antioxidants. There are many mechanisms where it's helpful with cancer. And I would recommend that most cancer patients aim for a minimum of 4 cups a day of green tea without sugar.
Is all green tea created equal,
Actually, the studies, yeah. Well, it's not created equal in terms of taste, but in terms of antioxidant benefits, yes, it appears that even the less expensive brands have as many antioxidants as some of the more expensive, tastier ones. So glycemic index, do you think this guy's going to have a high glycemic index or low? I heard low, and that was right, because it's not a carb. It's typically only carbs that we think of. So carbs are typically going to be things that grow in the ground or off a tree. All right, so here's what happens when we eat that Raisin Bran for breakfast. Your blood sugar goes up, and then oftentimes about an hour and a half, 2 hours later, it actually goes below baseline. And you feel cranky and anxious again and want something else to eat. Whereas if you eat your oatmeal, and typically I would also recommend that you have some nuts and some fruit, something with fiber, maybe a few prunes on top, you'll get a slow rise in your blood glucose, and it stays up for a long period of time. There's a researcher at Harvard named David Ludwig who's shown that if you give children low glycemic index breakfasts, they eat about 800 calories less per day. All right, factors influencing the glycemic index of a food. Simple versus complex. I'm going to change that to be refined versus unrefined. We want to stick with things that would have been here 10,000 years ago. So eating foods that have not been processed, have not been changed by man. We want to eat foods that have a high fiber content. Again, that's going to be things that typically aren't processed, haven't been changed by man. Things that aren't processed. And then other macronutrients in your food or your meal can change the overall glycemic load of what you're eating. So remember that oatmeal. Add on some nuts. That will, add on some fat. You add on some prunes or some fruits. That also gives you a little bit more fiber. Typically, I recommend, and some cinnamon, there you go. Typically, I recommend when you eat, try to eat a fat, a carb, and a protein at the same time. For this reason, it will slow down the digestion and absorption of those foods. So here's an ad for a better start in life. Start cola earlier. Not how soon is too soon, not soon enough. All right, so glycemic index and obesity. The low GI foods, as I mentioned in the study from David Ludwig, it's going to control appetite, control hunger. You want to reduce your insulin levels so you're not getting those high peaks, and that will help reduce inflammation and reduce insulin resistance at those cell membranes. Fiber, we already talked about the average American's getting 10 to 12 grams of fiber a day. The guidelines say aim for 25 to 35 grams of fiber, but in actuality, we evolved with much higher levels of fiber. Dennis Burkitt was a missionary from England who traveled to Africa in the last century, and he wrote home, "The bigger the stool, the smaller the hospital." I do recommend that you not skip meals. You want to try to keep your blood sugar steady, so kind of graze throughout the day, and try to combine that fat, protein, and carb. Will it be the mad cow beef, the hormone chicken, or the mercury fish? I'll go with the vegetarian dish. Pesticide or hepatitis? Well, maybe just water. Point source or agricultural runoff. So you are whatever you eat. And I alluded to this earlier that we used to have dairy from cows that were eating grass in their sunshine-filled pasture. And now we're having our meat and our dairy from cattle that are fed corn, and typically it's pesticide-laden corn. Corn is high in those omega-6 fats that promote inflammation. So similar to these cows you see here, you also have farmed fish. Farmed fish doesn't have the same benefits that wild fish do. So would you rather have this guy or this guy? These are on my mom's grass-fed beef farm. If you were my husband, I'd poison your coffee. If you were my wife, I'd drink it. So there's a process called Zeno Hormesis that has to do with how we often imbibe things that we weren't bargaining for in the foods that we eat. How you get various phytochemicals and chemically modified food ingredients in among the food that you're eating, and that can influence your own hormones. So I was talking about this to a patient this morning. When you have dairy, you are having milk that's teleologically meant for a calf, right? And that calf is typically 80 pounds when it hits the ground here, and 6 months later, It's 500, 600 pounds sometimes. That milk is meant for a calf that's going to be growing really fast. It's full of hormones no matter how you cut it. It's fuller of hormones if it happens to be from cattle that are getting bovine growth hormone that stimulates production of milk and really increases production of IGF-1. IGF-1 is like insulin, and when you mix it in the lab with those cancer cells, it grows. So no matter what you do, dairy is full of estrogen, progesterone, somatomedin, growth hormone. Humans are really the only animals that drink milk beyond babyhood, much less milk of a different species. So I really think it shouldn't be that we're all getting 564 pounds of dairy every year. We should reduce that. When it comes to meat, the way that meat is being produced nowadays is the cattle, spend 6 months of their life on the farm, and then they go to these confined animal feeding lots. And they're mixed in on these muddy patties with many other cattle in a very stressful environment. And they're given 70% of the world's antibiotics to prevent disease. They're given hormones to make them grow faster. And then they're fed corn, which they really aren't evolved to eat corn, but it's typically corn that's pesticide laden and full of those omega-6s. So the meat that comes from these conventional ways is really not that healthy for you. And then I'm going to go into something that's a little bit far out there, but has to do with this Zeno Hormesis concept. And that's kind of has to do with the energetic qualities of what you're eating. Would you rather have meat from the animal that's up on the right side or meat from the guys down on the left? When we're eating the meat from the guys on the left, they're full of stress. We're imbibing energetically some of that stress. I grant you it's a little far out there to think of, but if you look at cultures from thousands of years ago, I said, don't eat your meat in anger. Don't eat your food when it's been prepared in anger. Don't eat in front of the TV. We're eating foods that are going to become part of us. And energetically, you'd rather have meat from an animal that's had a stress-free life. It's grown up happy on the farm, out in the pasture, with all its buddies from the get-go. So if you look at some of the environmental toxins, they're ubiquitous. We can't avoid them no matter how hard we try. All of us in this room have rocket fuel in our bodies. If you look at newborn babies, who you would think would be pristine and the best that they could be in terms of their environmental exposures, there's an average of 187 different chemicals in newborn cord blood. Most of them we know cause things like ADD or can be carcinogenic, but most of those things have not even been tested in terms of whether they are safe in humans. So we've shifted from a pristine environment 100 years ago. Most of these chemicals have just been since 1900. And they're everywhere. Genetically modified, I talked a little bit about earlier, but again, it's very new, only been in our food since 1994. There are studies in lab animals that show differences like increased weight, increased metabolic syndrome, altered reproductive function. I think until we know for sure that it is safe in humans, we should lobby our government to, at a minimum, label our foods. And if you can, avoid them. I would assume anything that's coming in a box or doesn't say non-GMO on it, I would assume it's GMO. So anything that you get at a fast food place is going to have genetically modified food in it. Y'all heard of the Morgan Spurlock experiment, right? Morgan Spurlock ate McDonald's for 1 month, and anytime they asked him, do you want to supersize it, he said, I would say yes. He gained 24 pounds in 1 month. His liver function test went out the roof. He became depressed. He started craving the next time he could eat. So if you want to find out where you should spend your organic food dollar when it comes to vegetables and fruits, you can go to ewg.org, and they give you the list of the dirty dozen where you really need to, if you're going to have those foods, buy them organic, and then the ones that are the cleanest that you could potentially buy not organic. And it changes every year. So does this kind of eating work? Yes. This is a study of patients with breast cancer, and they divided them up into groups that exercised regularly and had 5 or more servings of vegetables and fruits every day. And you can see the survival rate of this group is twice the others. This is a study looking at 70 to 90-year-olds in Europe, and they looked to see whether they were eating a healthy Mediterranean type of diet, whether they exercised regularly, where they drank minimally alcohol, and did I say non-smoking? So they had those 4 categories. The ones who adhered to all 4 categories had 50% the death rate of the others. So 50% less heart disease, 50% less cancer, and they died 50% less often. So how do you eat for your genes? Eat a low glycemic index, low glycemic load diet. Eat nutrient-dense foods, lots of nutrients per caloric buck. Eat low allergenically, and I think we have to do a whole nother talk about the gluten and casein from dairy. Those are the most of the highest antigenic loads you can get. Have an optimal fiber diet, and flip-flop the salt and potassium. We used to get much more potassium in our diets than we got sodium. Now it's the other way around. But did you know cultures still exist where they're having that high potassium diet and they don't get blood pressure as they age? We all assume that it's natural to get high blood pressure as we age, and it doesn't have to be so. So I wish all of you the best on your health journeys. You've been a great audience, and really appreciate your coming. Okay.